A chemical peel removes layers of skin by applying a chemical which creates a controlled burn to a specific depth. There are various types of chemicals which can be utilized to create these burns or peels. Peels can be helpful in improving the appearance of wrinkles, texture issues, pigmentation problems, and some scarring. Department stores often sell exfoliative chemical products which will only affect the most superficial layers of the skin and generally do not require the supervision of a doctor or healthcare provider. These types of products obviously are of benefit only to those with the most delicate superficial skin issues. Physicians can also prescribe medications such as Retin-A, which also provides superficial exfoliation. Here is a list of alpha-hydroxy acids, which occur naturally in many fruits and are frequently used for superficial skin peeling. You've probably heard of some of these, such as glycolic acid. The limited exfoliation allows easy application and no real recovery period. Increasing their concentrations, however, can produce deeper peels which cause exfoliation over several days and allow stimulation of new collagen formation. Again, being very general, these types of agents are often useful for very superficial wrinkling, pigmentation, and texture issues.
Some chemical agents applied by physicians are very strong, affect much deeper layers of the skin, and require anesthesia to administer. Again, to explain in a very generalized way, the deeper or more severe the wrinkling, pigmentation, or texture issues, the stronger the chemical needed for treatment. The stronger the chemical needed, the higher the risks, and longer the recovery time. Examples of relatively light and deeper chemical peels and the associated recovery period will be shown later.
TCA, or trichloroacetic acid, and phenol are more commonly used for deeper peels to help improve more substantial wrinkling, pigmentation, or texture issues. By increasing their concentration, a greater depth can be reached and a more significant effect.
Chemical peels are almost like an art form for estheticians and physicians. The type and strength of the various chemicals used today worldwide vary greatly. By changing the concentration and combination of these agents, many different formulas can be created for use. These customized formulas are helpful when considering many unique skin conditions, and are also one reason that results vary among physicians and estheticians. The skin is usually pre-treated and prepared to remove surface oils to allow a more even treatment. The concentration, chemical ingredients, application technique, and post-peel regimen must be carefully planned. This will decrease the chances of the peel being too deep and causing complications. The depth of the peel during the procedure is gauged by the person doing the peel based on his or her experience with the agent, as well as certain visual indicators. The degree of postoperative inflammation caused by the peeling agent usually gives a good idea of the depth reached and the effect accomplished. The skin often exfoliates over 10 days, which means a longer recovery period. As the old superficial layer of skin comes off, a new layer emerges and new collagen is deposited in the skin. This process leads to a variable degree of improvement of the skin qualities and provides more youthful looking skin.
Generally, TCA is less toxic than phenol and its effects are milder. Phenol has a higher risk of being absorbed by the body and can cause irregular heart rhythms if not applied carefully. Chemical peels will not provide the results obtained from a facelift. They will not remove excess skin or cause elevation of tissues that have fallen over the years. Some of the peels, however, can provide limited tightening of the skin.